Hello, welcome to Root Cause Medical Clinic. My name is Dr. Vicki Peterson. I'm one of the founders here at the clinic, and I wanted to go over with you some of the frequently asked questions that we hear. And one is our process, how do we work? So we're unique in a number of ways because as a medical clinic, we are a team. So we have medical doctor, we have functional medicine doctors, we have a registered dietitian. On the physical medicine side of the clinic, we have chiropractic and physical therapy teams. So we have really, our patients call us a one-stop shop because we look at the body as a whole. And when it comes to patients that are visiting us from long distance or working with us exclusively long distance, then of course we're not doing the physical medicine part of what we do. We're doing the internal medicine, the functional medicine, the root cause medicine part of what we do. And what's unique is a few different things. One is that your initial consultation is completely complimentary. A lot of doctors don't do that. The reason we do it is that this type of care is unique. It's new for a lot of people, and we really just like to ensure that we get a good feel for what's going on with your body and you get a good feel for how it is we work so that we know we're a good fit. Because if you're somebody who has chronic migraines or an autoimmune disease or type 2 diabetes, just to name a few, and you say, listen, I'll take any vitamin you want to give me, but I will not change my diet, then it's not going to work. So we should just find that out from the beginning, right? And not have to go forward and not have to have you spend any money on care when it's just not a good fit, because that's not how we work. We are all about getting to the underlying root cause of why your body is malfunctioning and giving you the symptoms it's giving you. And that's never going to include a terrible standard American diet as something that doesn't have to be altered, okay? Also, because we're a team, we do a lot of collaboration. We'll ask for any recent lab tests that you've had, and we'll look at those behind the scenes before you even have your first paid phone consultation. So there's a lot of behind the scenes work that occurs so that we've data gathered as much as we can from the metrics and lab tests that you have on your body, in addition to a really good history, so that we start to formulate a plan. And then of course we have additional labs that we will need to do depending on your situation. And that really is a lot of our success, is having at our disposal these functional medicine labs and tests that give us the answers that we need. I mean, the frustration is that you've been told, well, we don't know what's wrong with you. We've done a whole bunch of tests and you seem fine, meaning you're not diseased. Or you actually have a disease process, but you're not feeling well, the medications have bad side effects, or you just want to know if you can get off certain medications and not have to take them the rest of your lives. There's obviously different scenarios for different people, but I think our uniqueness is really in, also another point is that we very strongly know, having done this for over 25 years, that the human body's ability to heal itself is quite miraculous. It's a very tough machine. However, it can get overburdened, overtaxed, and our whole goal is to find out what those burdens are and remove them so then the body can heal itself. And that really is what happens. Your body heals itself. We don't do the healing. We remove obstacles to the healing, and then there the body goes, and with less obstacles, it's able to get back to doing what it can do, which is heal itself. So I hope that gave you some insight into our process and how we work. And I think there's another thing I wanted to add, which is that our programs are programs. So it's not a visit by visit moment. Once we've really established a plan, and so we've gotten data and we've gotten to know you and we've got a good history and we have our laboratory tests back, we have a plan that we lay out of what it's really going to take to correct the problem. Now, we're not new at this. We've been doing this, as I said, close to 30 years. And so understanding on average what it takes to achieve a certain goal is something we're very familiar with. So what we'll do is we'll lay out a program of this is how many visits we think it's going to take over what period of time. So you really know what to expect. So I hope that answered that question, and there are some more that you can look at as far as our frequently asked question area.